This is a question about treatment. If you've been through pretty much most of the treatment options that are out there, like you're right at the end of the line and you've got no other things, there's nothing else that they can give you, is it possible to just go back on one of your hormone blocker tablets or something like that?
Often with the hormone-positive breast cancer, the cancer cells eventually become resistant to those endocrine therapies, so those hormone-blocking therapies. Sometimes some of the treatments that you have on the way through can change that a little bit. So sometimes some oncologists will try things like oral capecitabine, which is an oral chemotherapy medication, but unfortunately the further you get down, more and more treatments, those hormone therapies tend to be less and less effective. So sometimes we do use them in combination with other things, and especially we think about things like clinical trials, which can often, if we can find one that patients are eligible for, extend the amount of treatment options. So certainly I don't think going on to one of the aromatase inhibitors like letrozole or back on tamoxifen is going to be harmful. Unfortunately, it's probably not going to be likely to be too effective in getting a significant clinical response with the cancer. But certainly, occasionally I will give people breaks from chemotherapy, and we might think about going on back onto hormone therapy for a little while. Usually once the cancer cells have become resistant, it's not something that's likely to be effective again further on down the track.